Hello, I'm Jessica Baillie and I'm an adult nursing lecturer in the School of Healthcare Sciences at Cardiff University. Thank you for the opportunity to present at this conference. This presentation is entitled Seeking Help When a Crisis Occurs, Insights from a Mixed Method Study with Patients Using Peritoneal Dialysis and Their Families, and this postdoctoral study was funded by RCBC Wales. I'd like to take the opportunity at this point to thank the patients and family members who participated in this study and the healthcare professionals at the sites for recruiting to this study. During this presentation, I'll provide an overview of the background to the study, the methods that we used, key study findings and conclusions. So the background to this study. Kidney failure is increasing and peritoneal dialysis is one treatment for kidney failure. It's home-based, it's a daily treatment and it preserves vascular access, it promotes independence as patients or their families manage it themselves, and it's more cost effective. But peritonitis or infection of the peritoneum is a common complication of PD and it can result in patients needing to change treatment, antibiotics, hospitalisation, morbidity and mortality. The literature shows that patients who experience peritonitis are more likely to be depressed, experience anxiety and have a lower quality of life. And the qualitative work has shown that peritonitis is associated with pain and guilt and confusion about what caused the complication. Patients with increased knowledge about peritonitis are less likely to develop the complication. However, there have been very few studies that have explored what patients know about peritonitis and what their experience of this complication is. So the aim of this study was to examine patients and families' knowledge, understanding and experiences of PD-associated peritonitis. This presentation will focus on patients and families' help-seeking intentions and actions when peritonitis was suspected, as these were really key findings. The objectives of this study were to design, pilot and use a structured questionnaire to identify patients and families' knowledge of peritonitis and also their experience, so in terms of what symptoms, for example, alerted them to peritonitis, and then to explore in depth patients and families' knowledge and experiences of peritonitis via semi-structured interviews, and then to synthesise the qualitative and quantitative data. So ethical and governance approvals were gained. A questionnaire was developed from the literature with input from patients, families, healthcare professionals and researchers. And the questionnaire examined participants' knowledge of peritonitis and what happened if they experienced peritonitis. And it was administered over the telephone with 75 patients and family members from 6 sites in Wales and England. And the data were analysed using descriptive statistics. The second phase of the study involved recruiting a purposive sample of participants who completed the questionnaire. And in-depth interviews were undertaken with 30 patients and family members, either in person or again over the phone, and explored participants' experiences of preventing peritonitis and if they developed peritonitis, their experiences of this. And the data were analysed thematically. Okay, so the questionnaire results. Participants were asked if they suspected that they may have peritonitis or their relative may have peritonitis, what would they do? And 73 participants, which is 97.3%, reported that they would seek immediate help from the clinical team if they suspected peritonitis. Only 2 participants said they would not do this. However, 28 of these participants went on to experience peritonitis, either as the patient or as a relative who supported the patient using peritoneal dialysis. And of these 28 individuals, 18, which is 64.3%, stated that when peritonitis was suspected that they did seek immediate help from the clinical team, which is much lower than the 97.3% of participants who intended to seek immediate help. And the qualitative data helped to highlight the complexity of this. In reality, peritonitis was difficult for some patients and relatives to identify. 2 key indicators that peritonitis may be occurring is a cloudy dialysis bag and abdominal pain. But Kieran explained here that he struggled to identify what he should do when he had a cloudy bag. So he said, I was still new to this. It was late at night, the dialysis bag looked slightly cloudy. I don't really know if it's going to be a problem or not, but the next bag will tell me for sure. So I'll wait a bit, and after, if I leave it overnight, in the morning, if it's still like this, then I'll ring my home therapy's room and get some advice. When some individuals then decide to seek help for suspected peritonitis, it could be challenging to access appropriate help. Doreen described trying to get help from the renal ward for her husband who had severe abdominal pain. and she reported how she spoke to the renal ward and was told, oh, it's very unlikely that it's peritonitis, but the registrar does suggest that you go to A&E. Delays in seeking help for suspected peritonitis or in being able to access help for suspected peritonitis led to serious consequences. Audrey described how her husband waited 7 hours for an ambulance, and when they were then in the emergency department, she said, I took samples down to the renal unit because I asked them, the emergency department staff, did they want samples, and they said, well, they didn't seem interested. At 6 o'clock that night I was told, oh, it's only a stomach bug, your husband can go home. And at 8 o'clock they rang to say that he'd been admitted and that he was in with peritonitis, and he was in for a month. So Audrey describes there that her husband waited 22 hours between the onset of symptoms or signs of peritonitis and actually having a diagnosis of peritonitis and appropriate treatment starting, and that resulted in him having a month's stay in hospital because by that point his peritonitis was very severe. For some participants, these delays in diagnosis led to transfer to haemodialysis. So Jean has commented, it was horrendous the first time because they didn't realise it was peritonitis. Because my bags were clear, it went on for quite a while. They thought I just had a tummy upset, and by the time they'd found out, I went on to haemodialysis then. So by that point, Gina's peritonitis was so severe that her dialysis access had to be removed, and she went on to haemodialysis. For some participants then, when they were diagnosed with peritonitis, it came as a shock to them. All participants in the study spoke of the stringent methods that they used to try and prevent an infection. So when an infection happened, they reported feeling shame and blame at being diagnosed with peritonitis. So Catherine explained, the doctor came and said, what have you been doing? And I thought, well, actually, I don't know what I've been doing because I've been so careful, and that made me feel, I'll be honest, it made me feel really embarrassed and dirty. So to conclude, the quantitative data reveal differences between participants' help-seeking intentions and actions in response to suspected peritonitis, and the qualitative data demonstrates the challenges of identifying peritonitis and accessing prompt assessment and treatment. Further work is needed to support individuals to recognise peritonitis and to seek help from healthcare professionals promptly to prevent further morbidity. But they also need to know that when they're accessing help for peritonitis, that they'll be able to do so without fear of judgment. And non-peritoneal dialysis healthcare professionals need further support to recognise suspected PD peritonitis and to recognise the urgency of prompt management. Thank you very much for listening to this presentation. And if you've got any questions, please don't hesitate to contact me on the email address on the slide. Thank you.